there any for our first couple speakers? Okay, sure. This would be for the ECOG.org? Yes. I would email, I would actually check with your administrator at your site and have them email membership services. Okay, anybody else? Okay, well, thank you very much. We're going to have about a 5-minute break, and then when we come back, we're going to start off with drug management and then auditing, monitoring, and QA. Thank you very much.
Oh, okay.
Emails off.
And if, oh, okay.
Monitor.
In it, just like rotate it. That might be easier than trying to move it. And I think when they were setting up, I think this was over. So, but yeah, I think if we just I can, yeah.
Yeah, that's a little better. Yeah, maybe just move the clock a little. Okay. Yeah, that you can see. Thank you very much.
Forms.
Like everyone's gonna get so
Do we really need?
I know, I'm actually I'm slowing.
America is
Well, yeah, just about 1 minute, we'll get started again. There we go. Okay, ready? Okay. Okay, everybody, we're going to go ahead and get started again. Our next topic is drug management, and I'm happy to introduce Alvin Blackman and Ravi Kem from the PMB.
Good morning, everyone. So I'm Alvin Blackman, my colleague here, Ravi Kim, and we're from NCI, and we're going to talk about investigational drug accountability, which is always a favorite topic, right? So let's look at our mission here, the PMB mission, and our mission statement. You can read from there. So what do we take from that mission statement? So our goal is to enhance communication, support clinical trial sites, and decrease audit findings, which is a very important thing, right? Because who likes audits, right? Oh, you do? Okay. So what does PM do? What does PMB do? So let's look at the agent management side. So agent ordering, distribution, drug information resources for our investigational agents, also distribution of our IBs, investigational brochures, and our material safety data sheets. Now, from the agent management side, we have listed here some policies and guidelines. When you get opportunity, you can go look on our website and go over. It talks about agent distribution, local destruction, and agent transfer. But let's talk about a DARF. And sometimes we get that question, hey, what is a DARF? Well, it's a drug accountability record. And we have an example here on the right. This is just a regular DARF. And it's a document agent for disposition of our NCI supplied agents. And so agent disposition, receipt, return, all of that's incorporated in this form here. Now, we do have electronic accountability systems that are out there that you can use, but the most important about that is that the paper printouts must be identical to an NCI DARF. And you do have to maintain separate DARFs for each protocol, agent, strength, and formulation, and order investigator. So let's look at an example here. We have a clinical site. We have multiple investigators that are assigned to this site. So which one should we choose, right? Well, we recommend only one that you choose for the ordering investigator. And if you do have an inactive investigator that you're considering, well, you can use them, so make sure they get registered and active and have an active registration. We talked about it before, maintain separate DARs for each protocol, agent strength, formulation, and order investigator. Now, we're going to maintain separate DARs for each study participant and patient-specific studies. So let's talk about dispensing areas, control versus satellite. So for control area, this is where you're going to receive the drug from us, from PMB. Now for the satellite, once that drug is received from the control, you're going to transport it to the satellite. Now even though that drug is transported to the satellite, the control is still responsible accountability for that drug. And in transporting to the satellite site, if you're using your local logistics channels within your hospital are fine. If you have to use a FedEx or UPS, that's something that is not for satellite. And we may need to set your satellite, turn it into a control if that's the case. And if the drug is going to be kept in a satellite for over 24 hours, then you need to set up a DARF. And remember for your satellites, if you have unused, expired, or controlled, unused, expired, it needs to go back to the control. So it's not a satellite to a satellite. Anything that you did receive from the control needs to go back if you're a satellite site. So what about agents, right? We want to transfer an agent from one protocol to another. So the most important thing when it look, make sure we have an active investigator. Their CTEP investigations are active, and it's the original transfer investigator. And if not, it's the investigator that originally previously received the transfer agent. And they have to be eligible for the trial, and make sure it is documented in your DARF. And remember, only whole containers can be transferred. So let's look at a DARF. Now, this is an oral DARF that we have here. And as you can see, let me point. So this is of a control record. You could have a satellite DARF as well. And so all these things need to be completed. So let's look at the highlighted portion here in the header. So these are just things that site, investigator, drug name, dosage, bottle, things that you have to have completed. Let's look at the other highlighted portions in blue, and as you can see here, let's start off. This is where all our accountability starts, right? We receive the drug from NCI. We're going to increment it in our inventory. We have a total of 8 bottles, and you can see here the balance, the lot number, and also the recorder's initials. All right, so let's go ahead here. So let's look at a patient that we dispense to. We'll see here the date, the patient ID, the patient's initials, and the total dose that they received, and also the bottles, and we'll decrement from the inventory. Now, what if we have a situation where the patient, let's say a month or two, is going to return? We're going to make sure that we annotate the date is returned and amount of bottles, and also we're going to initial there. So let's go into a quiz question real quick. A controlled dispensing area pharmacy responsible for all the drugs inventory, which include drug inventory and a satellite dispensing area. True or false? Okay, true. Okay, I see a true. Okay. Right. So that is true, right. So all control dispensing pharmacy is responsible for the drug inventory. So even if it goes to the satellite, ultimately the control is still responsible for that. All right, so let's go to another quiz question. Electronic accountability systems may be used and paper printouts must be identical to NCI DARFs. True, right? So we do have other electronic means out there, Invesco, and long as it's identical to our NCR DARFs, that's not a problem. All right, so let's move into Aurora. And it's not just EDARFs, although we're still working on EDARFs, so it's coming. But no, Aurora is a centralized agent inventory management system. Now, this system replaced our old system about a year ago and has access to documents, stock recovery, notices IBs, which I mentioned before. Also, creation and maintenance of a PSD, so a pharmacy shipping designee. Now, with Aurora, it allows our pharmacy shipping designees to have multiple control sites addressed to, as long as it matches with the investigator and the RCR profile. It allows the hand communication within PMB so we can communicate in Aurora, and creations of electronic record that will soon come, which is our EDARFs. So let's look at just our flow here with just Aurora. So Aurora, we have, for agent ordering, you can do site setup that we have, and you can establish your satellite sites. So once we transition to the EDARFs, you can see agent receipt, agent dispensing. These are things that you'll be able to do. And also with the flexible DARFs that allow acknowledgement from our designees, and also pharmacy shipping designees can update dispensing areas and designees as needed. So how do we get into Aurora? Well, system requirements are here. Make sure you have an active CTEP registration. And just remember, too, that it does time out in 15 minutes. Now, it does warn you, but it does time out in 15 minutes. So if you are working on work, please make sure to save it. Let's get a view of just what an ordering designee would see for Aurora. So if you can see from the dashboard here and look at the several cards, it's a really good view of just everything, your orders that you have, EDARFs, pending, local destructions. So it's really gives you a good opportunity to view what's going on at your site. So how do we set our site up? Well, that's important. The main thing is setting your site up, setting your control site, and then setting up your satellite site. So there's some things very important to do. For your agent ordering, so when you do order, as you can see, view an order, it allows you to view the order. You can see it submitted, you can see it processed, shipped, even denied. You can click to find out the reason why and when it's approved. So agent accountability dispensing in Aurora. So now this is part of the EDARF module that we don't have in place yet, but it's coming. So it allows you, if you do want to dispense, it allows you to actually pull the patient ID from open. And also, too, if you do want specific lots, say you want to have lots, our specific dates that we have on there, on the bottle. And also, too, if you do have a specified use date, our date that we have will override yours. And also, too, if you do want it to dispense, say you get it in 2 bottles, but you want to dispense your patient in capsules, it allows the flexibility for that. All right, so inventory adjustments. So you do have an option, if you do have a discrepancy, that you can make adjustments. Now, this is the last option after you go on over and try to reconcile your inventory, but you can actually make an inventory adjustment. You just need to have a comment fill. All right, and agent verification. So this is important too if you want to verify what you have on hand versus your document record that you have, just to verify that your amounts are the same. All right. So local destruction. So with the EDARF, you can actually destroy it locally versus sending it back to us. So why would I want to destroy it, right? Expired, it's unsuitable for use, it can't be transferred to another trial. So a wonderful option that we do have. And let's look at agent transfers and award. So you'll be able to actually transfer versus doing paperwork to try to transfer that. And you know why we want to transfer an agent? Change the PI, change the protocol status, patient's off study. So, but now remember, if you don't have the EDAF module, you'll have to still do the normal process of doing the paper process. Okay, so let's look at agent transporting to the satellite. So it's a simple thing here. As you can see, you can look at the control record. We want to transfer it to the satellite site. And that's all that's required. Well, first you want to wait to get approved, but once it's approved, you're done and that occurs. Now, if you don't actually have EDARF, you know, EDARFs the satellite site would need to be created before you could do this transfer. So if it's not created, then you couldn't do a transfer from a control to a satellite. So just a quick thing about accountability. We have access to Aurora training videos and links here. And we have Aurora frequently asked questions. It's a good thing if you want to look. And if you have any questions or anything, you can also use our PMB after hours email address.